Good afternoon, everyone. Welcome to the Mental Health Awareness Initiative. And today we have three musketeers with us. The three psychiatrists, Dr. Nimish Gupta, he's from Ranchi, Dr. Saras Prasad from Noida, and Dr. Shivam Dubey, he's in US. I guess due to the lack of the difference between the timing, Dr. Dubey will not be accompanying us. But welcome to the show, Dr. Nimish and Dr. Saras.
Thank you so much.
Thank you so much, Hina.
Hello all, and thank you. We are honored to be here to be talking to you, Hina.
Yeah.
Thank you, sir. And thank you so much for taking out the time because I know you both are extremely busy these days and would like to know as to what do you think is the mental health, the importance of it from your perspective. Dr.
Right.
Nimish, if you can
So,
highlight.
yeah, mental health is extremely important. In order to enjoy a stable and a satisfied life, it is important that in the same way that we take care of our physical health, we must also take care of our mental health. For example, when any parts of our body hurts, we know that we have to go to a doctor. And so, similarly, what should we do when we feel emotionally drained or mentally unstable? Same, we should go see a mental health professional. Mental health should be a natural concept. It should be without prejudice. It should be without stigma. Now, as you asked, the importance of mental health today. Now, as we know, we are living in unprecedented times, and fear, worry, and stress are normal responses to perceived or real threats, as well as when we are faced with uncertainty or the unknown. So it is normal and understandable that people today are experiencing fear in the context of COVID-19 pandemic. Today, people are facing a threat of unemployment, financial constraints, homeschooling of children, working from home, a lack of physical contact with other family members, friends, or colleagues. So it has become even more pertinent and important that we look after our mental as well as our physical health. The stress in the environment itself has increased. Until unless we start taking good care of our mental health, uh, it will start having a negative impact on the quality of the life we live.
Absolutely. And that is very rightly and concisely, put up in one package that yes, everyone is going through the unprecedented time right now, and the uncertainty part has increased all these factors that you have just mentioned. That is very true.
I was just saying the uncertainty and unknown, coupled with lack of social comfort and social contact, is a deadly combination because humans, as such, are social beings. We seek social comfort, and being bound to home has cut us off with the entire world. Although the virtual world is still there, but a physical connection is equally important for a human being.
True. So, Dr. Saras, if you can throw some light on the current
Yeah,
time right now.
yes. Right. So I completely agree with Dr. Nimish. Whatever that he has mentioned is absolutely bang on. And I would just like to add one of the quote of the Austrian neurologist, and he has given immense contribution to the field of psychiatry, and we all must be knowing his name, Sigmund Freud. So as he said, mental health is ability to love, work, and play, and at the same time feel contentment and enjoy while doing all of those things. So at a very basic level, the definition of mental health would be the ability to able to work, play, and enjoy and feel contentment. And the contentment, as Dr. Nimish also pointed out, comes immensely from the social contact, validation, approval, and human touch. So all of those things right now during the times of COVID, we are all missing out, and it's definitely root cause for a lot of people suffering through anxiety and depression, especially during these times. Yeah.
That is true. Dr. Nimish, if you can tell me what actually is the difference between a psychiatrist and psychologist for our listeners?
Right,
Because it is
definitely.
interchangeably used also.
Yeah. And I would, to add on to that, I would also like to explain a little bit more about a lot of jargon that is used. So we talk about psychiatrists, we talk about psychologists, talk about counselors, we talk about psychiatric social workers. So essentially, I would briefly try and describe what a mental health team comprises of and what are their individual functions. So a psychiatrist is a medical doctor. So they complete their MBBS first, then they go on and do their MD, that is super specialization in psychiatry. Now, a psychiatrist is the only licensed mental health professional to give medications for treatment of psychiatric disorders. Now, a psychiatrist, along with the medications, can also provide a patient with psychotherapy. And whereas a clinical psychologist are RCA licensed, and they're licensed to provide treatment to persons with mental health disorders. They examine by means of using assessment tools, and they provide psychotherapy as a treatment modality for disorders such as anxiety, depression, specific phobias, OCD. A psychiatric social worker, they specialize in social work. They deal with patients in the communities. They specifically are trained to deal with patients and their caregivers. They provide psychoeducation about the mental health disorders to the patients and the caregivers, as well as help spread awareness within the community. They can also provide counseling and therapy sessions. Now, counselors, they have different streams with different governing bodies. They are usually MA in psychology or related allied sciences, and they provide counseling for various mental health issues. There can be a different subset of counselors, such as there can be a relationship and marriage counselor, there can be a child counselor, there can be hypnotherapist, guidance counselor, career counselors. Along with that, we have psychiatric nurses, which essentially function in a psychiatric hospital based setting and are associated with the management of psychiatric patients in the hospital. Apart from all of these mental health professionals, there are also some allied fields which work in collaboration with mental health professionals to improve the overall quality of care provided to the client. And they include occupational therapists, art therapists, music therapists, speech therapists. So together, mental health team works holistically to provide wholesome treatment customized individually to the patient's need for them to improve their productivity in life or contentment, like Dr. Saras was talking about, self contentment.
That is a wonderful information, and I'm sure the listeners now can actually know the difference between each. I'm very curious to know, how are you all three connected as a team? Are you all working on some secret project or something?
Yeah, so essentially, not so secret, but yes, we have been working on a project. I got in touch with Dr. Shivam about an year back, and thereafter, after collaborating on certain ideas, we reached out to Dr. Saras, and that's how all three of us got together working on a same project. Now, our aim has always been to improve the accessibility of mental health within the country. The major
Okay.
problem that we have in India is there is lack of mental health care providers, and most of them are concentrated in the cities, metro cities, or tier one cities. Therefore, there's a lot of lack of accessibility in the rural areas or tier three cities, as well as which coupled with a lot of stigma and myth attached with psychiatric disorders in those communities, it leads to a increased burden to the society. So, with that aim in mind, all of us have come together to develop a product which is essentially teleconsultation platform via which a client will be able to reach out, seek, and book an appointment with a mental health professional and be able to consult all from the comforts of their home. Also, us being psychiatrists and attached with mental health personally, we try to remove or reduce the lacunae that one faces in having a teleconsultation than in terms of when comparing it with physical consultation. So our approach is to provide wholesome, team-based, holistic care to the patient as well as to the caregiver, so as to improve the mental health status in the country.
So
So
your
our product name
platform,
is Yes Mindy, and I hope we are running we are on a tight schedule, but maintaining the timeline, and we hope to launch in July.
that is very interesting. Would be looking forward to it. So your platform will be catering to all the categories of mental health workers that you have just listed down.
So right now we would be having psychiatrists and psychologists as well as counselors, and we plan on adding psychiatric social workers soon in the next phase as well. So we have something special planned for them. But right now, during the launch, as of now, we would have psychiatrists, psychologists, as well as counselors. We have been developing assessment tools and worksheet modules to improve the patient care as well as compliance and to help the mental health professionals at better diagnosing the symptoms that the client comes with.
Yeah,
Wonderful.
to sum up, Hina, it will be like a Maharaja Thali of mental health solutions. It will have everything in it.
And now then I'm sure that anyone who is going to have a thali will always remember your product that you all are coming up with.
Yes, yes, of course,
Okay.
and that has been the plan, and we have been very passionate about that holistic approach and end-to-end solution, so that the patient does not, and the client does not have to go to any place and just get served as soon as they step into our platform with everything that they need.
That's interesting. And if you can just, Dr. Saras, that now that you have talked about, okay, you have a holistic approach, can you
Hmm.
highlight briefly as to what the listeners can, gauge from your experience? What is the journey from, for a particular client when they enter into a therapy session or when they go and meet a psychiatrist? Journey
Yeah,
to
Hina,
recovery.
absolutely. This is, yeah, exactly. So this is quite a valid question, and this question is not very frequently attended, and people don't get to read about it every now and then. But then it's very important to realize that people have a lot of dilemma and confusions, and they have a lot of anxiety and apprehensions going into the session with psychiatrist or psychologist, which is sort of, it has a lot of myths. So basically, going to a psychiatrist, going to a psychologist, going to a counselor for any of the mild, moderate, or severe problem is just as soon as you step into the session, it is the skill of the psychiatrist, psychologist, any mental health expert who is skilled. You don't have to plan and go into this session. So interviewing skill is one of the most important skill set that we learn while we are undergoing the training. So interviewing skill makes the patient feel comfortable, rapport is established, there is empathy into the relationship between the patient and the mental health expert, and one tends to just speak their problem one by one, and they narrate their story really well, and that is what it makes them feel quite relieved even just after the first interview. So at times it's said, a good interview or a good mental health expert who is skilled of in taking interview, they heal the person half just after the interview. And it has been it has been happening with us. I'm sure Dr. Nimish will also agree that once the patient, they meet us, the client meet us, when while they're walking out of their first session, they feel relieved automatically, and you gain a different perspective while talking to a professional, and that perspective probably you can put into use in your further journey of wellness, and you will get diagnosed, you get proper treatment, you get prognosis of it, and you get to know what to do, what not to do to prevent any kind of relapse and gain more and more clarity in your treatment journey. So it's more like a relationship that you build with the therapist, with the psychiatrist, without thinking much. You just need to meet one of us and just start talking, and everything falls in places automatically.
Absolutely. I absolutely agree to what you say because as a therapist myself, I do experience what you have just mentioned. They do feel relieved immediately after the first session itself. And this brings me, just question just struck to me that have you experienced people asking to you that if mental disorder is genetically, transferred to the offsprings?
Right. So that is a very commonly posed question by a lot of our caregivers, especially young couples who now are starting off their families. So to sum it all, mental health disorders are multifactorial in terms of their etiology. So there is a definite role of genetics, but it does not pass on from parent to child in a linear fashion. Let's say, for example, there are conditions in which if one of the parent or both of the parents have the disorder, then there is a high likelihood of a child having it. But mental health does not fall into those categories. So if there is a high genetic burden, let's say many family, the risk of someone developing a mental health disorder, if we are purely talking about the risk in terms of the genetic risk, depends on the number of family members they might have, a person may have, which may have suffered with psychiatric disorders, the relation or the closeness of the relation of that person with those family members, they all play a role. So yes, there is an increased risk, but that is not a linearly defined increased risk. So a person with may have vulnerabilities in them. Let's say if both their parents were suffering from a severe mental health disorder, let's say from severe depression, then a child born has vulnerability to develop depression in their life. But that vulnerability will only be exposed in times of severe stress faced during that time. Also, while that child is growing up, they will be developing their personality. So they will be developing various coping mechanisms and resilient skills in order to cope up with such stressful situations. So even if a child has vulnerability and they develop healthy coping mechanisms, or they have resilience, then there is a possibility of them not having or not developing a mental health disorder even in the face of adversities. On the other hand, if someone has no history of psychiatric disorders in the family, they also have a high risk of developing psychiatric disorders themselves based on the stressful situations they might have faced during their childhood, during their current scenarios. Also, the factors that can be important are such as parenting, social support. So, all in all, it is a multifactorial in which multiple factors they play a role at the right time to cause a mental disorder or for an onset of a mental health disorder.
Okay, so if I have to just sum up what you have said, that despite of the fact that the parents, for example, if they are identified with any mental stress disorder or something, but the child, though the chances are like they may develop, but it's also dependent upon what environmental or circumstances they grow up in. That is subjective. And even if the parents are not identified, then also depending on the circumstances the child grows up, that will affect the person's personality and thus the inclusion of such disorders.
Yes, yes. The basically
Right.
it takes nurture and nature both. So nurture
Absolutely
versus nature. Yeah.
true. And Before we wind up, I would like to know from both of you whether you have experienced any stressful or challenging situations since a year. If so, how did you cope?
Yeah, so I myself got COVID positive while I was at home, and I was taking break from hospital. So while I was at home, I got COVID and stayed in the room for almost, I think, 25 days. And it was sort of an experience that I would like to remember, but also forget. So like to remember as in I got to learn a lot of things staying in the room, and I faced it myself, so I know how it feels now, and would like to forget because it was not easy. It took a lot of effort to really cope up, but then it is definitely a challenging but possible task to stay in to cope up and get well and bounce back to your normal life. But then definitely it's quite challenging mentally, physically, and also it's quite exhaustive. But then it did teach me a lot coming out of it. So this was this was my experience this year.
So, if you can just quickly say three tips for those people like who are still struggling to recover from this, how to hold
Right,
on.
right, right. The first is to get all the due rest that you've been willing to have, all the due hours of sleep that you've been willing to take. So this is the time: sleep, rest, and watch and catch up with all the series that you can on your iPad, on laptop, or on your phone. And then also at the same time, when you're getting bored and when you're getting frustrated, so you need to be really patient and probably take this time to just think about the situation, what it would be coming out of this situation, and what would you like to change about it. And then suffering through such miserable time, it gives you a very different perspective towards your own self. So it's in a way, just need to be patient, you need to rest, you need to enjoy, you need to get all the services that is possible if you are fortunate enough to be with your family. So I was with my family, like they were staying outside, but then I used to get a lot of good food and everything. But then वो अलग बात है, I could not taste anything because I had lost all the sense of taste. But then yes, you need to stay strong, you need to be patient, and there is always positives in the situation that you're going through.
That is very encouraging, and I hope you're feeling well now.
Yeah, I'm good. I'm well now,
That's
thank you so
nice.
much.
And with you, Dr. Nimish, if you had to say something
So,
about your experience.
if I have to talk about the challenges, I would say this entire pandemic has been a challenging time, challenging experience for everyone. I would say, especially the frontline workers who have been working out there despite the risks to themselves. And so I have been facing the similar challenges myself, just like any other doctor working in a hospital is. But for us here in our hospital, we have almost 500 bedded psychiatric hospital, wherein only the patients stay for 15 days, 1 month, so depending on how long they require treatment for. And the guardians, they admit the patient and they leave and they come for discharge. So one of the most challenging time was when the sudden lockdown was imposed, and we were and literally almost 300 to 400 mental health patients were stuck in the hospital because the guardians had no means to come in the absence of public transport. And most of the, as this is a centrally government hospital, most of the patients they come from a low socioeconomic status, so did not have personal vehicles to come. So those were challenging times. We were, along with the management and the administration, we had formed a COVID task team, and we were developing protocols as to how to go about, how to maintain quarantine within the hospital so that the patients staying inside stay safe from the roaring virus outside the premises. As well as even at that time, Dr. Saras was here with me working in Ranchi last year. So we were part of the student union as well, students and resident doctors union as well, and trying to do our best in terms of providing them the comfort that we quote to our students and junior doctors who had been working as frontline workers in throughout the pandemic. Although we do not directly uh, uh, care for COVID patients, but mental health patients, the stress of mental burden on the patients as well as the caregivers have increased several times over the last 1 year due to the
Absolutely.
ongoing pandemic. So yeah, so that has been my experience so far.
So, on behalf of our listeners, I salute you and the entire team, those who held on in the pandemic and took care of all the patients at that point of time. It's like hats off to all of you. And before I wind up, I would
Thank you
like
so much.
thanks a lot for your time and would like to congratulate you all for the work that you are doing and for the product that you are developing, which will be launched in the coming few months. All the best for that.
Thank you so much, Hina. And we also would like to, like, on behalf of Nimish and myself, I would like to, thank you so much for having us. And it's really great to know that the kind of podcast and the channels and this way you've been supporting the audiences and the listeners. I'm sure they are getting, very useful information and support through your channel, through listening to you and all the experts who've been coming onto your channel. So I think it's quite a good job that you've been doing. Thank you so much on their behalf as well.
Thanks a lot. The contribution that you have made today vis-a-vis, describing the journey part and the difference between the individual mental health workers, this will be really helpful for our listeners because they do need information from, recognized people, standard people, like those who are in the field actually, at the ground level. Thanks a lot once again,
True.
and all the best.
Yeah, thank you. Thank you so much, Hina. Yeah.
With that, we end the
Thank
episode.
you.
With that, we end the episode for the day. Hope to see you tomorrow again, same time, with another guest with their perspective on mental health. Till then, stay safe. Bye.